United States of UK to discuss about cardiac rehabilitation in Sri Lanka, and as well as the benefits of cardiac rehabilitation.
Thank you. So thank you. I was invited to come and talk about cardiac rehabilitation, of which the benefit in developed countries has been known about since 1973. It is hugely important because atherothrombotic disease, atherosclerotic disease, is a lifelong process. So the role of cardiac rehabilitation is to try and change patient behavior so that they are aware of their cardiac problems, and by changing behavior they can reduce the risk of further cardiac events. And that is the goal of cardiac rehabilitation, and several studies show that it is very effective in reducing cardiac risk.
Okay. What type of patients should be getting cardiac rehabilitation for Zama?
So all patients that have come in with a cardiac condition, typically the majority of patients who undergo cardiac rehabilitation are those with established coronary artery disease. So typically these are patients who've undergone coronary revascularization, either percutaneous or coronary artery bypass graft surgery. Patients who've undergone valve surgery also benefit, and patients who have treatment of heart failure also benefit. So these are the groups of patients who have derived the most benefit from studies of cardiac rehabilitation.
Professor Ahmed, what are these benefits? Can you explain the benefits?
So the hard core data is about patient outcomes. So there have been numerous studies that have shown significant reduction in cardiac mortality over 4 to 10 years. If you look at combined endpoints of cardiac ischemia, repeat myocardial infarction, and cardiovascular death, you see a huge, in some studies, of 70% reduction in composite endpoints in these patients. In addition to the hard endpoints, there are also what we call softer endpoints. Patients feel better. Quality of life questionnaires show that. They perform better in their daily tasks. They are more confident. They are able to engage with society. They have improved sexual health. And these are all the other benefits which are soft endpoints, but equally for the patient, very important.
Okay. Now we are talking about cardiac rehabilitation programs. What is a program, and who are the people who should be involved in these programs?
Yeah, it's very important. So the program cannot be led by one individual. It has to be a multidisciplinary program that involves the patient's cardiologist, their general physician, their primary care physician, a physiotherapist, nutritionist, and a psychotherapist. It is only when you have involvement of all of this multidisciplinary team that you can hope and expect to see adherence to a program and also successful outcomes. In respect of the multidisciplinary team, they have to be conscious of the individual, their family, their personal setup, their background, and of course any cultural and social sensitivities that apply. So it has to be an individualized program for that patient for it to be successful.
Okay. By doing this program, we have seen now the benefits to the patient, and how does it helps the government or the Ministry of Health by doing this intervention?
Yes.
Is it cost effective?
Yeah, very good question. So cardiac rehabilitation is like any other intervention in the cardiovascular world. It has to stand the test of cost effectiveness. So we are used to hearing about cost effectiveness of interventions such as coronary stenting, of devices in patients with heart failure. What is less known is about the cost effectiveness of cardiac rehabilitation. And there's a very important study that shows that the quality adjusted life years is hugely in favor, showing a €25,000 benefit of quality adjusted life years for a successful cardiac rehabilitation program. So although it is low tech it's cheap, but ultimately the benefit to the individual and to society and to the payers of healthcare, it is very, very favorable.
Yeah, so see, it's such an effective intervention in both ways, cost effectiveness and the benefits to the patient. What do you think are the barriers of implementing such a program in a country?
So the most important barrier is education and awareness. And that applies not just to the patient population, but it applies to the physicians and the cardiologists looking after their patients. For too long, cardiologists, and I'm guilty of this as well, have been too focused on the interventional treatment because that has increased rapidly over the last 10 years. And we focus on what we can do to the patient in theatre, whether it is putting stents in, whether it is putting pacemakers or other devices, or whether it's doing operations. So it has to start with the cardiologist recognizing that cardiac care is not just in the hospital, but it is lifelong. And we have to inform the patient that this is just the start and cardiac rehabilitation is part of a spectrum of full cardiology care for that patient.
Okay. Thank you very much, Professor Aman.
Thank you.
Thank you.